My name is Pushkar Mehra and I'm Chair of Oral Maxillofacial Surgery here at Boston University and Boston Medical Center. My role as Chair is pretty much to knit everything together and establish what is a global or panoramic view of where we are, who we are, what do we want to become, and how do we get there. How has the department evolved over the years? That's a good question. I think it's our ability to be independent, innovate, progress, and work together as a team. Till about 10 to 12 years ago, we were a medium-sized department with 3 or 4 faculty, and we've gone up to close to 13 full-time faculty all at one hospital. We pretty much integrated all of our education into one campus with a lot of cohesiveness, and we complement each other. It's one of the few programs in the country where we kind of work in what I call our own centers of excellence. So we have dedicated surgeons for TMJ and orthognathic surgery, dedicated pathology, reconstructive surgeons, dedicated team of attending staff focusing on implants, anesthesia, etc. So you actually learn from superb specialists. We have 5 fellowship trained surgeons, each with different areas of expertise and interest. I think our ability to change and progress and continue to adapt is our biggest strength. Other strengths, I think, of our program, Boston is a world-class city, very well known as the Mecca of education, biotechnology and healthcare. We have a VA hospital, we have two level 1 trauma centers, both at Boston Medical Center and Beth Israel Deaconess Medical Center, and we have a dental school. There's a lot of collaboration with other services. BU is one of the most funded research universities, so there are a lot of research opportunities on campus. Our alumni, besides our residents and staff, are our strength. We have over 25 part-time faculty, mostly alumni, who come and share their expertise with the residents. They take night call.
Hi everyone, my name is Dr. Ruben Figueroa, and today I'm going to be explaining or talking a little bit about my roles here at Boston Medical Center and Boston University. At the present time, I am the director of the outpatient oral maxillofacial surgery clinic and dentistry. Both of them are together. I have been here since 1999, and I have been taking care of different roles where I've been here. I was at that time the director of the doctoral education, and now I'm basically at the hospital at Boston Medical Center as a director of the clinic. Other roles that I have are I am in charge also of the anesthesia education for the students, for the residents, and we have 2 different areas that the residents will go and do IV sedation and general anesthesia. One is at the Boston Medical Center and the other one is at the dental school. During your first year of rotation here, you're going to be exposed a lot to the Yaki Clinic or the Boston Medical Center Clinic, and there you will be in direct contact with the faculty. We have 5 faculty that go to the Boston Medical Center Clinic, and you're going to be doing dental alveolar surgery. During this first year, you're going to be exposed to all type of dental alveolar surgery. You're going to be doing extractions, simple extractions, surgical extractions, alveoplasties, trachea removal. You're going to learn how to manage patients. You're going to learn about the medical history, how medical conditions that the patient has. You're going to be involved in the inpatient management at that clinic and at the hospital. During that first year, that's when you're going to be learning a lot of local anesthesia and a lot of dental alveolar surgery. Like I said before, you will have the opportunity to go and participate, or at least observe the cases that are being done for IV sedation with general anesthesia that are done either at the hospital on Wednesdays or at the Boston Medical, the BU Dental Clinic. Besides that, the Boston University Clinic will provide, you will be there for most probably 2 months straight, and you will be running a room that is going to be like if you were in your private practice. You're going to have an assistant assigned to you, and this room, this area, you're going to run it like a private practice. There, you will have patients with full mouth extractions, alveolar surgery. You're going to be practicing or doing a lot of nitrous oxide by yourself, and you're always under the supervision of the faculty that is in that clinic that day. UC Clinic is a very busy clinic. We see over 15,000 patients a year in that clinic. That clinic, we have 6 chairs, and you're going to be always with at least a minimum of 2 faculty. You will have one-on-one training at that clinic with the dental alveolar surgery. You will be also seeing the inpatients that need to come to the clinic to have procedures done while they are at the hospital. This clinic is intensive. You're going to see many patients with many different medical conditions and dental conditions that will need our treatment.
This is the Oncology Clinic. I'm Dr. Salama. I'm here on Wednesdays and Fridays. We see about 60 to 70 patients a week in the Oncology Clinic. So my clinical interest is head and neck oncology and benign pathology. I think we're probably one of the busier units in the city of Boston, even when compared to even other non-OMS head and neck providers. So here you'll see typical oral cavity squamous cell carcinoma, salivary gland disease, benign pathology, and lots of stuff that you won't see anywhere else. Interesting pathology. There's about 70 different languages spoken here, so we have a large refugee population. So the exposure here is really unlike anywhere else in the city of Boston, for that matter. It's probably unique on the East Coast. I chose head and neck oncology for 2 reasons. One, it's data driven, and 2, it gives you a tremendous tool set, and not just a hand skill tool set. So doing head and neck oncology gives you a complete different soft tissue operative skill set, but it's also a different way of thinking. So since I finished my fellowship 13, 14 years ago, I've become more philosophical about my teaching approach. So rather than teach procedures, I concentrate on teaching thinking and problem solving and complex problem solving.
So my area that I focused on is about implantology, obviously bone grafting, soft tissue grafts, placing of dental implants, restorations, all the different aspect of training for the resident to be really ready when they go out into the private practice or academia to be fully trained in implantology. We have a lot of exciting things that are going on, and the journey started around 3 years ago, where the whole school and the department went into a digital mode. Let's put it this way, we started with more guided procedure, whether it's a single unit or full arch unit, then we transitioned to the stackable guide, where you're doing implant placement, bone reduction, different aspects of your implant treatment. And recently we actually had 2 great instruments that we added to our resident training, which is the navigation, and we have the YOMI robotic unit. Actually, we're the first university, we're actually the only department in the country that has the robotic assisted implant system, which is called the YOMI. And it's been an exciting journey. Now we have the option of doing single units with it, we can do full arch units with it. We can plan the cases on the same day and execute them. So the residents actually have a great experience that comes at multiple locations that they get experience. So one, we have the VA, where they have prosthodontists at the VA and general dentists that they work with. Over there, they get their experience with bone grafting, soft tissue grafts. I usually work with them 1 day a week. There is another full-time attending that works with them the rest of the days. Usually over there we're doing more like conventional guides, free-handed conventional guide type of procedures. So that's where they get that experience with the the conventional implant placement. When they come to BU, we have great collaboration with the prosthodontic department, so they plan their cases with the post residents, and it's a full treatment planning from start to finish that they do. We train them fully in digital planning. So we have 6 systems that we've been using for digital planning. We have the Simplant, we have the Galileo, we have the DTX Studio that they do, then they have the XNav navigation digital planning system and the UOMI digital planning system. And we're just adding the co-diagnostic, the Straumann digital planning system that should be coming in the 6 months. So they're really fully trained in digital planning of cases, whether they're going to do it guided, navigation, or robotic. The other exciting thing, we have our old prosthodontist at the hospital, Dr. Hader, that the residents work with, get their prosthetic aspect on top of what they get in the school. So at each of their locations, they have prosthodontists or restorative dentists that they're collaborating with, and it's the whole idea is to learn about collaboration, how to treatment plan properly those cases and execute.
Ultimately, I've been here at BMC and BU for just over a year now. I did all my training down in University of Pennsylvania in Philadelphia, and then I did orthognathics and TMJ surgery fellowship in Charlotte, North Carolina. So got here last September and have been building a practice in essentially those specific areas. Additionally, I do some secondary trauma repair, a little bit of nerve repair as well. So, for instance, we actually just got a new 3D printer as well as an intraoral scanner that we're going to be getting set up next week so that we can do everything digitally, impressionless, and then to print our splints for orthognathic surgery or TMJ in-house. For instance, for TMJ, I actually did everything from very minimally invasive arthrocentesis, laser-assisted arthroscopy, to more open procedures. For instance, today I'm doing a open arthroplasty discectomy with an abdominal fat graft. Wednesday I did a total joint replacement here, and this was all planned and custom with a sagittal split on the other side. My favorite aspect of becoming an attending is you guys. So you get to see people come in who really just finished dental school and are figuring out how to even navigate in a hospital, and then by the time they're finished, they're able to do these very complicated and complex procedures essentially from start to finish, and it's very rewarding to see that.